Welcome, Nikki. Welcome, Sylvia.
Hello.
Hello. Sylvia,
Yes.
do you know somebody named Leah Gibbs? She's with Hawaii's Department of Health, I think.
You know which area?
Um,
We have like 5,000 employees. So
so it really helped to narrow it down, huh?
Hey,
No, but I
Brian.
can find out.
okay. Just even like generally, because we have environmental health, we have adult services, we have children's, maternal child health kind of thing. So um
She is
oh, I could look at our directory actually. What was her first name?
Leah,
Yeah.
Leah Gibb.
EAH. Yeah. Hmm. Hmm. See her there. She doesn't, she's not in our directory. Oh, hold on.
Okay.
No, we don't have a Leah Gibb as a Department of Health employee.
Okay. I'll have to ask her again. She knew Christina. I could be wrong, so I
She
just
could
saw
be
it.
a contractor or she could be one because we have a lot of contracted providers.
I'll follow up with her.
Okay.
Well, I think we might have another person or two hop in here. Um, but I do want to kind of just take the time that we have, and if we can give you guys some time back, we can give you guys some time back. But I think the last few times we've met, we've not had any shortage of discussions. So I think we'll get going here. What I'd like to do is just um, little mini agenda I put together, but I want to just kind of recap what we're doing, particularly because I think we have a couple people. Brian, I want to kind of read you up on what we're thinking and where our heads are at. And then I want to talk a little bit about we had landed last time on the idea of creating kind of a rural AI framework, things that were accessible for rural, underserved communities, ways that AI might be able to impact them. I drafted a little bit, I just kind of put some ideas together, wanted to look at that, kind of get some feedback from the group, and then talk about some next steps with that. And then there's been a lot of AI resources that have been popping up both internally to the TRCs and externally from other sources. And I want to kind of spend some time brainstorming on how we can kind of best start to pull those together. And if there's some way to kind of house those somewhere that can be accessible and kind of useful, organized for both this group and an external group. And then I wanted to give us some time to kind of talk and discuss next steps. Does it sound like a plan? Okay, so uh, by way of recap, kind of where we were at last time was we spent the last two times that we were meeting really trying to narrow down who our audience for this might be and kind of what we want to accomplish. And last time we determined that what we needed was something helpful and accessible for kind of rural, kind of our core audience, rural and underserved. So small healthcare organizations, individual providers, folks that just kind of need to know a little bit more about AI and how it could impact them in rural health. And we had kind of started uh, talking around this idea of what if we made kind of a framework for how AI might be impactful for rural health? What were some of the kind of low-hanging fruit for AI in rural health, and what might those look like? And we kind of started having a conversation around the different ways that AI could interact with healthcare, and specifically the four large topics we were kind of looking at was patient engagement, provider support, administrative and business support, and then clinical imaging. All these are names are just kind of ones that we had kind of discussed briefly. They can all be changed, but that was kind of the structure that we would hang kind of our ideas on for AI and rural health. The output would maybe look like something kind of a one pager that would talk about some of the different areas of AI could be impactful in rural health, either with some examples that were already happening or some potential examples that we could discuss. And then that each of those could at later times be broken down and kind of, we could do a deeper dive on each of those areas, each of those solution spaces, and kind of come up with more information. Is that about kind of where we landed last time? And anybody have any questions on that? Okay. Brian, I know all this is new to you. Does that sound like, does that make sense to you kind of from a conceptual point of view?
Yeah, absolutely. Sounds good. I'm kind of excited.
Okay.
I apologize I wasn't at the last meeting, so I'm looking forward to hearing what's going on here. So thank you.
It's great. So what I did, and I sent this out in a PDF format, which is not the most editable format, but I at least wanted you to see kind of where my head was at. This is definitely back of napkin, but I started to add some sub bullets to each of these kind of frameworks, and I wanted to kind of go over what we have there, talk about some of the contents in those, and then kind of go from there, see what discussions we get going. Let's see. So, and again, draft title, but AI in health in rural healthcare, and I'm calling it a framework. But again, the four large categories would be patient engagement, provider support, administrative and business support, and clinical imaging. And then I was trying to kind of break down some of the thoughts that I had around what some of the things that AI, the impact AI has within those different categories. My feeling is patient engagement is probably the most challenging one in the short term, in that I've seen a lot of ideas crop up around AI and patient engagement, but I've not seen a lot of kind of fully formed solutions. A lot of them are around chatbots and things like that. But this is one of the areas I kind of think needs a lot more fleshing out. And I would really like, I think we can probably kind of work together to kind of come up with some thoughts. But
So Jordan,
likely,
I'm just seeing your desktop right now. Is there?
oh, I'm
Are you sharing the
sorry.
presentation?
Am I sharing the wrong thing?
If everybody, and maybe everybody else was seeing, I was just seeing, look like your desktop there. Looks like, there we go.
Okay. Okay, I think I shared a screen and then flipped it to another screen so I could be looking in the right direction. That didn't work. All right, so here's the structure that we have. Again, the four large topics: patient engagement, provider support, administration and business support, and clinical imaging. Again, any of these like larger topics can be renamed if we have a better way to say it, but those were kind of the four large areas I thought that we were thinking that AI could be most impactful kind of in the rural healthcare space. Patient engagement, again, I don't have a whole lot of like sub bullets for that, and maybe we go through some of the other ones and then circle back to that one. I have some thoughts in there, but I wanted to kind of query the group and get feedback from everybody else. But should we start with some of the other topics, kind of talk about what's here, and then see if we can add to the list or kind of discuss it in more depth? So with provider support, a lot of what I have been kind of looking into and hearing discussed is around how do we best document the visit that the patient's having with the provider. And there's a lot of like accessible technologies around like note taking or note creation, dictating the actual events of the visit, and then kind of putting those together in a format the provider can review. And then I'm really interested in kind of using AI to collect vitals, having an AI clinician space where kind of vitals information, whether they're written off, described verbally, or they're collected from sensors in the room, kind of are able to add to that note. But that was kind of what I was thinking on that sub bullet of visit documentation. We have thoughts from the group on that particular one. see, I can't even spell. Right? Is it decision? Oh no, I had it right. Okay.
I was gonna say you're outsmarting yourself now.
I know. I played myself. Um, so what kind of the purpose, what I'd like to do with this session is kind of identify if maybe there's some big topics that we're missing in each of these categories. And then I'd like us to kind of split some of these up and then go and see if we can't find some examples or kind of delve into these sections a little bit more kind of within the group. So that's kind of the purpose and the arc I think I wanted to describe for what we're going to do today. Does that make sense to everybody?
So Jordan, do you want us to add things that we think fit under visit documentation?
Sure.
Or can you scroll down a little to see all the subcategories?
So we got administration and business support. Yeah, let's just run through them real quick. Like collecting patient information. So like check-in processes, demographics, insurance collection, things like that. There's been a lot of work already done around improvements to coding and billing, using AI to look at a visit note and determine kind of the best coding and billing. Improving data analytics, so rapidly creating visualizations and data resources from healthcare data, and then using AI for process improvement and revenue cycle. And then in the clinical imaging space, this is by far seems to be the largest and kind of most, it's the most like in use place of AI, but it's also, you know, I think in the TRC meeting, I described like AI inside, like, you know, solutions that are using AI, but they're not as obvious to the users and the patients. This is kind of some of that AI inside technology, but lots of AI being done for improving radiology reads, the notes for radiology. There's a lot of things around diabetic retinopathy and ECG readings and note taking.
Okay. So as you scroll up under provider support, or maybe it's patient engagement. I think this is kind of where the AI framework comes in terms of connecting the dots between potential diagnoses and patient education, med education, med interaction.
Yeah, so I think this is where the having things available in other languages
Mhm.
also falls into it, because the patient engagement allows the patient to actually receive the information in their first language.
Yep, absolutely.
And the other patient I'm not sure under patient engagement, the consenting being able to be done not only in English, but in the patient's first language. And which is really important, especially for when we do genomic sequencing. It's important because it's so complex, the consenting.
So
Do you
yeah,
think
Surgery
maybe that's
consents are
under
complex.
administration and business support, or even under the collecting patient information? Or does that need its own section?
I think consenting is kind of a combination of patient engagement, provider support, and administration, because it's such an important part of a medical experience.
Okay,
So if it's a visit where, you know, you just have regular visit, or a surgery or something more, you know, getting more invasive, you know, the consents would be, AI would really help in maybe ensuring that the patient really understands what they're consenting to.
well, yeah, and so that was going to be my next thing, Sylvia, is not only the language, but the appropriate level of comprehension.
Absolutely.
So what we're really talking about is accessibility, right? So
Yes.
language complexity.
So maybe we
Um,
need a section that says accessibility rather than trying to fit it in, because it's, and I wonder, the other part is, there's the law where patients are allowed to get all their medical records and everything. Maybe AI could help get the medical records in the language the patient can actually read.
yeah, so I think documentation access to, so one of the, and we need to do, I think access to access to records is definitely something in.
So would it be better considering that as a health disparity kind of section where AI has the potential to help mitigate some health disparities? Because we want to use the buzzwords that everybody else is concerned with nowadays.
Well, and I think it's language access, right? Your language access plan.
So here, so what, okay.
I think another category under patient focus would be automated patient engagement or reminders. I think that that's something really powerful that AI does that doesn't, that could be really beneficial in that situation or to that demographic.
Yeah, there's other things too. Okay.
Referrals.
Yeah, I see. One of the things I'm really interested in is how AI will be integrated into a lot of the patient portal technology that we're seeing. So pretty much all the EHRs that have, they're getting to be fairly robust patient portals. But the information's there. It's just not, it tends to be layers deep. And I think AI is a tool for kind of, you can kind of just tell it what you want, and then it's able to kind of find the information you're looking for and bring it up to the top of that patient portal is a potential, or really a useful thing that AI can do in this space. But again, I've not looked at a lot of solutions that are kind of focused on that. But um, this one I'm a little. AI and chatbots is like, chocolate and peanut butter, but um, there's a whole, it's a whole big category of what they can do and what they kind of shouldn't do. Um, but I think for getting to the, getting to the right specialty or getting to the right kind of answer for what you can kind of tell it what you want to do, and it can help you figure out who you need to get in touch with, or kind of get you down the path is really useful. I think we're a little bit mixed here too on you know, what can AI do now? What? Um, I think those are kind of some of the things we need to think about because we're talking a little bit about both things that AI currently does, some of the things that it potentially could do, um, uh, and then we need to talk about like how it has impact. See, again, I don't know that must be spelled right because it's not telling me I'm wrong. Anything else kind of in that patient area? I think we're starting to pull together some good stuff there.
So are we trying to address things that should be done with AI and then things that we don't think should be done with AI? Because that's an opinion paper, basically.
Yeah. So the discussion we had last time, and I think what's really helpful, I think the most useful thing is for us to talk about things that AI is currently doing or currently capable of doing. The problem is like as soon as we put it down, there'll be 30 other things that we didn't include in our list that it can do. And it's kind of embedded in a lot of things. But um the thinking or what I think would be most useful is to talk about if you're a rural healthcare provider and you know that AI is important and you know that it needs to have an impact and you're not sure how to kind of start, what are some of the things that what are some of the things that problems that AI is already solving was kind of the thinking that where how I was approaching it. I think what AI does for patient education is it can really customize it, right? Like you can give it parameters and it can create something that's really specific to a patient, kind of based on their disease state, based on their history, that sort of thing.
Yeah, and I mean, it customizes it, right? So everything that the patient has in their history, it'll pick up on and provide education about it. Because sometimes when a patient's in the hospital, it'll just the physician or the nurse may just note their most recent diagnosis, whatever they're being seen for. And so that's all that they're providing education on. But, maybe they were diagnosed with diabetes 20 years ago and they don't really follow, and that's contributing to kind of the onset of some of their latest diagnoses. So I think that's one convenient thing with AI is it takes their whole history. And so in terms of patient education, medication, you know, interactions it has being AI, it functions, differently than our brains do, and it puts it all together in a big picture.
Not to just drop random buzzwords, random places, but yeah, I think kind of looking at the whole of the patient, this is sticky, right? Like, well, you're sick because you're poor, but um that's a challenging how do we want how to communicate like these things affect people's health, but those aren't necessarily things that we kind of call out all the time. Okay.
Well, I've done that education with being poor, like how to make better food choices when all they have in their neighborhood is liquor stores and convenience stores and 7-Elevens, and
Right.
how to go for a walk or get exercise when they don't live in a safe place, resources, that type of thing.
Mm.
I think that the practitioners that work with these underserved populations and in rural areas would have a very difficult time customizing that information to their patients.
Well, and
And I
maybe
think-
Sylvia, maybe it's not customizing, but maybe it's providing a list of agency and resources.
Sorry, I'm clicking out of things.
Because you're right, customizing would be extremely difficult for a provider to do, but in terms of AI, if they have, different resources or agencies that are available, whether it's like a senior center or a community center or a YMCA or whatever.
Yeah, our complication is that the providers practice differently. So we have the really concerned, engaged provider who will make sure that they give the patient enough in-person and AI content to help them. Then we have the people who are like, literally burned out. I don't want them to be like, I'll just trust AI to do everything and I don't need to do as much kind of thing. And I don't know how. I don't think it's up to us to mitigate that, but I think that that is definitely a hazard of having AI available, to have people who aren't engaged be less engaged.
I
Unfortunately,
like
we are
that. So
seeing that.
Yeah.
over reliance on AI or
Or unfettered, like not checking it or validating what you're getting.
unvalidated.
Yeah. I think this is a great conversation. I think that there's two different groups that are going to be tapping AI for their needs, right? It's a patient that's having a conversation, and just something that really I'd never thought about is the potential of a patient in some of these circumstances that may not have access to like great technology. They may have language that's not necessarily easy for AI to understand. And so if they're trying to have like a chat conversation with like an AI engine of some kind, that could be a pretty complicated manner as far as it like understanding, like Siri has a hard time understanding me sometimes, and that could be a pretty interesting proposition for some of the patients. I think the providers would have better access and like an understanding of how to like cue the AI, and it depends on how they're trying to use it and like how much automation we're trying, like some of the services are trying to get, or that we're looking at, I guess. So but just fascinating. So
That's a good point. So are we talking about resources that the patients have and find themselves, or are we talking about resources that are made available to patients by like healthcare systems and things like that, right? So I guess I was kind of looking at this from the lens of like, things that are available through your patient portal, things that are available, made available to you by your healthcare system, like tools, and how they impact patients. But doesn't change the fact that, like, I think we're going to see a new space where kind of AI is the new WebMD, right? Like, you're like, hey, I don't feel so hot today. And, you play 20 questions with your chat bot and it kind of helps spit out a diagnosis. And that may not necessarily be tied into a healthcare portal or things like that. That's stuff that, Chat GPT can kind of already do. It hems and haws about it, right? Like, hey, I'm not a medical professional, but it'll give you information for sure. And there's a whole slew of stuff that patients may go out and find themselves. Or hey, I'm just taking a picture of this thing. Is this something I need to be worried about? Right? Like, here's a mole, and I want to upload it and take a look.
I think to your point, you talked about like the like MyChart or whatever the patient portal is, as far as the intake. I mean, because that could become a conversation as a chat triage. It's almost like a chat to say, this is what I'm looking for with the site. And, it can either be like typing that out or like natural conversation. I think what everybody's hoping for eventually is that it's almost like just having a conversation with it. And that's where I wonder like how much it can interpret like dialects and accents, because that could be one of the challenges, is just like, clear speech and the system being able to understand it. But, you always have that ability to type it in. You at least expect, but I guess it still depends on the patient population. But I would think it'd be fairly easy for a provider to be able to queue some, like if you had some sort of a AI engine that was providing information like out towards the patient, for the provider to be able to queue it, to give it the cues, and then it would sort of be able to compile that information into some sort of a usable format would be, I think that would be pretty easily within the realm. I haven't found the companies doing that, but as I'm like sitting here, I'm starting to get a lot of great ideas as to who to go looking for, because there's got to be some people doing some of this in some of the space, trying to provide that service, I would think. So
Yeah. So, and we heard a little bit about this. There was several speakers that were talking about integrating. There are like AI solutions for interpreting,
yeah,
and like doing it in real time. And it's like the impression I got was this is right on the cusp of being really good, but it's not there yet. So like
yeah,
the English was good, Spanish was really pretty good, but there were like, the everything else like needed some work before it kind of was really
yeah.
accessible and really usable. But absolutely, I think that's one of the things that we need to find some information on and definitely kind of talk about. So
Yeah, speaking like Cisco, even just built into WebEx now, like they've got, you can cross translate into several languages, and I think they're adding to them all the time. And it's the challenge I have is even the English translations, like the closed captioning on the screen, sometimes pretty inaccurate. Like depending on, the AI is not great at picking up all the conversations yet, especially in a space where it's a crowded room. But it does, it's pretty remarkable what it can do. So.
yeah, or homonyms or antonyms or stuff like that.
Yeah.
The hard part with the
Antonyms.
translation is that terminology sometimes doesn't exist in another language. Like
Right.
when I was in clinical work, there's a lot, I could not translate a lot of genetics things into Chinese because they didn't exist in Chinese. So you spend 200 Chinese characters describing the word that you're trying to do. And so the AI part is going to be interesting, because even when we do our translation into, we have Spanish fact sheets for patients. We concentrate on West Coast Mexican Spanish because ours is Western region. So even when you're doing translation, you have to know where the person is from to be able to translate the right terminology.
Versus Caribbean Spanish, that sort of thing.
Yes, exactly. Yeah. So
Versus
it's very
Spanish from
complicated.
Spain.
So I think we all agree there's a lot of challenges in that space. It seems like the systems are becoming a lot better at doing it, and I think that was the point that you were saying, Jordan, is there people are saying it's like right on the cusp of being good at a lot of this stuff, and I think that's exactly what we're seeing. But it's pretty crazy, like that all that technology is just so available out there. What I'm struck by is just now sitting here thinking about all the little places that this is now woven into that you don't necessarily think about, that we're already using AI, like, and just not really like aware of it. But, it's the simple things. But, Cisco definitely advertises, just like Zoom. I mean, it can do automatic minutes and things for your meetings. Like, so if you're doing the transcripts, it can organize that. And so it's, a lot of these systems are already pulling a lot of that as, in the background. And I think that's to the point of some of the administrative and business, like, but I think a lot of that goes into like providing information to the patients and things like that, or making things accessible, by being able to help you generate that information. The problem is again, if you become too reliant on the AI and don't validate what it's putting out there. So there's always a challenge, because you've got to go back and check it. and most people will default to the simple, like, go ahead and hit send before they do, probably. So it's a scary proposition, but definitely where I think things are going, though, like to the point, we're using these tools all the time, and it's being built into, like, Epic now pretty much has stuff built in to do some of this automatically. And if you're using like Zoom or WebEx with your Epic integration, you'll already have some of those cross translation features baked into the browser, without even like having to go add anything else. So there's some places it's already being woven in, and you don't really think about it until.
Yeah.
Anyway.
Well, and that's like one of the things I've been thinking about, and just, but there's gonna be a lot of this that's just, it's like those little Intel stickers you see, right? It's just gonna be AI inside, and you're not gonna think about it, you're not gonna see it. It's just gonna be doing a lot of the lifting. And it just, you end up with a smoother experience, and you're not entirely sure why. And I mean, and even down to the, like, optimizing traffic and improving, upscaling video and upscaling audio and doing all that.
Right.
Things that make a better experience, but you don't realize that are AI.
Yeah.
Because they're not a large language model you're interacting with.
Yeah, absolutely.
So we're not, I saw the clinical imaging stuff, but there's a lot of AI being used in lab analysis. So trying to get rid of the human error factor.
I put imaging here. I don't think imaging is right. So like it could be diagnostics. Is that a better, more encompassing term?
So it's more, it's it is diagnostic, but it's like AI assisted. So like in genomic sequencing, I mean, your genome is huge, so they use AI to help in their sequencing to find out what mutations might be present that could cause disease. But it's always reviewed by a certified medical geneticist at the end before the report is signed, because I don't think I don't think the Clinical Lab Improvement Act has allowed AI to be the one to sign off lab reports, but obviously it's one of the things that has been developed to help with complex laboratory analysis like genomic sequencing. But I'm pretty sure that probably even more simpler lab analysis is using AI from some of the things I read and hear about. But because, genetics is my area, I know it's used in genomic sequencing.
Yeah, and I know I know they're looking to use it for like white blood cell counts, like, taking an image of a slide, and then it can do the ratios and everything like almost immediately, where instead of having to count them up by hand and things like that. So this whole area, it bears some diving into in depth. I think the other thing that we've been hearing about is or things that I've heard about is AI for fatigue detection.
I'm fatigued. Where's the? Sorry.
Yeah. Well, I've seen a few papers on this actually, where they had radiologists that were doing reads, and the camera wasn't watching what the radiologist was doing; it was watching the radiologist themselves. And if they were, if their eyes weren't moving, in a certain, like they weren't viewing the entire image, it'd be like, hey, looks like you need to take a break. And it was reducing errors in lab results by looking at the people that were actually doing the reads. And I think AI is a tool for, like, detecting when mistakes are about to happen, and kind of doing some mitigation is a potential use. highly potentially contentious, right? Because like, I don't know that I'd want an AI telling me like, hey, you're screwing up, even though I probably need one. But we were doing some looking into some of the AI solutions for fatigue detection, but that was even a couple years ago that some of these reports were starting to come out. Anything that's visually based, diabetic retinopathy, there's several different AI solutions out there for this. Dermatology. Oh gosh, what's the word I'm looking for?
Like melanoma or
Yeah, image-based screenings for cancer, melanomas, um, uh, um, wound care. Okay. We're jumping around a bit, but I think we're fleshing some of this out pretty well. Think I would like to come and visit this here real quick. I think one of the places that and maybe potentially even for rural and underserved organizations, the place that is probably the easiest and safest lift is around a lot of these administrative and business support tools. So doing kind of the patient demographics collection, a lot of these things tend to be high value, low risk, to kind of processing all this information. You're letting people, who you're letting people operate at the top of their license, things like that. You're using and doing things that you were already doing anyway, like running census numbers and things like that, looking for trend analysis and all that. But you're just able to do it better because you have a better set of tools. So I think that's one of the things that, if we've got an easy win or some low hanging fruit in AI for a lot of organizations, it's around this administrative and business support. And I think this is kind of where we've seen a lot of the actual AI solutions kind of get implemented through, the different EHRs and through the different business analytics tools.
So Jordan, I have a clarifying question.
Sure.
The consenting, I feel like the consenting should be done prior to the patient coming into contact with AI. And the reason I feel that way is because the patient should consent to using AI, to using a platform with AI embedded. So I don't know how we separate that, but I just feel like that's a distinction that needs to be made. That the platform is not doing the consenting, that the patient needs to consent prior to even having the camera or microphone observe them.
That's a really good point. Yeah, or maybe you need a consent to be consented by AI, by a chat bot or things like that. But yeah, no, I take your point. I'm not, to be honest, consenting is not something I'm super up on, and I'm not aware of anything that's being done specifically. I know the idea of doing a lot of the onboarding for patients, like offloading that, kind of creating some automated processes, and I would assume consenting could be part of that, but I don't know of what implications might be in there. So
I mean, I'm betting you that there's like AI engines that deliver like a digital consenting form,
They do.
in a sense, in the interaction with it. So it depends on like what type of AI and like how it's being used. I mean, I think you have to consent, but you're probably almost going to have a notice like when you go to sites to say that, I don't know, there's already like AI that's being embedded into a lot of this stuff, and that so they may or may not be saying that AI is helping drive that solution. But I do think when you get to certain levels of interaction, especially if it's going to be AI like helping provide information, that's where that consenting piece is going to come in. If it's at like a collecting information point, that's just sort of the way that the health systems are probably going to be doing business, because they're going to be employing these tools that collect that information. Just like when you call on the telephone, you get an automated receptionist. You're going to sort of get that automated, as they onboard people. But at what point and what information are you accessing becomes where the consent is necessary. So if it's helping provide care in the sense that it's organizing information, I think at that point in time you have to. I'm not sure. That's a pretty interesting conversation to have, I guess. And I'd be interested to see what the lawyer said about that for sure. Because I mean, it's a health system using a tool that's organizing information, but it's who's validating that information and then who becomes liable if that information is not accurate. So I'd say it always comes back to the providers, but that's a whole nother conversation to have around AI. So
it's really dicey, Brian. And then you have the comprehension level. So, all of us on this call understand what's happening, but you put an 85-year-old in the ER who's going,
right.
confused and doesn't understand. For me, this is just a big stickler point, because when I just feel like when you're using AI, you're in the internet, right? You're on the internet, you're in the World Wide Web, your information's going out there, and whether it's considered PHI or not, protected health or patient health information, like it's out there. And so I just think we don't want to lose sight. I'm not going to get in the weeds, but you're right, Brian, it's a huge conversation, and it depends on how you're using the platforms. But I think as we are creating this resource for our rural partners or our rural individuals, that's something we need to stay on top of.
Mm-hmm.
I
totally
this is
agree.
so interesting.
I think to my point is I know my health system, and at some point they're going to be, I think when you get to the point of care, you are 100% accurate. But I think, there's probably going to be health systems using AI heavy in the onboarding of patients, and they probably would not disclose that that's what's happening, in a sense. Like, I don't know. I mean, you hope that they would, but I think when you move into patient care, it's a must, especially now, because a lot of this is fairly, on the cusp of it's all new technology. Some would go out to the internet. Some folks would be, at UVA, there's people that are building these databases that wouldn't necessarily go out to the internet. But I think if you're using it for patient care, I mean, that's a crazy new proposition that, you do have to have a deep conversation, and patients have to understand that. So I think, it's a new time. I think that's why we're having this whole conversation here. I mean, it's the point of this is because this is the time when new technology is coming at us that's never been used before. And there's a lot of potential for abuse if it's not used the right way. So I think your point is yes. I mean, we've got to be real sticklers about it. So governance.
Yeah, not only abuse, but like potentially malpractice too, like depending on wrong diagnosis, wrong medication, a lot of error.
Well, and you think so most of the consent documents I've ever seen are boilerplate, right?
Mm-hmm.
Like you only have one consent document, right? But if the whole point of this is to translate it and to make it more accessible, so you have a document that's been translated and then, been translated into a sixth grade Hindi or whatever, right? Like, how do we know that it's actually doing the job correctly and that it's actually getting the information across, and then that it's not, and then if it is it still a legal document at that point? Like, you downscale it, do you have to upscale it again? Like, because you're consenting, you're basically saying yes, it's okay to do this, and like, is how important is the actual language that the person's agreeing to? I've not done any kind of dive into this. This is such an interesting topic. I don't even know where to start.
But I still think with AI, like things with consent, which are legal documents, and it's just like when HIPAA got enacted, with AI, if they're going to use it routinely in their medical clinic or hospital, they're going to have to incorporate that into their consent as something to tell the patients. But like the practice of translation, especially of the legal documents and even for education, is you have to still follow the rules where you have to have the back translation and someone who is bilingual and certified be able to ensure that that translation is accurate to to what the person wants in the consent because it's a legal document. So again, that's where don't over rely on AI. You still have to follow the protocols that you do with your if you're going to give a paper translated consent. Like you can't just like say, oh, AI will take care of it.
So we're talking about two separate things here. I wanted to separate these out, right? One is AI is a component of consent that, hey, in the course of your healthcare treatment, there may be different types of interactions that you may or may not know that you're having with with some sort of AI component. And, making sure that we're kind of hitting that, and then AI delivering consent. So like as part of your onboarding, AI may deliver you a document, and then kind of what is the kind of procedure for that. And that's all really interesting and topic, and I'd love to dive into that more. So, and we obviously will need to. Okay. Um, any other thoughts, any things that we want to kind of dive into? I think what we're doing is we're laying out the framework for things that we want to kind of go into more and do deeper dives on. I think we're finding those topics, but anything else that we kind of want to make sure that we have on this particular list?
I think it's a great start. Pretty conclusive.
So what I'd like to do is, as folks in this group, hopefully one or more of these kind of larger sections has hopped out to us. And for next time, what I was thinking is if we could kind of go in, see if we can find some use case examples, or kind of give us some search parameters to kind of go in and do a deeper dive on, and kind of bring some things back to the group. Look for examples of this technology or technologies in these particular spaces that we might be able to glean from, things that we didn't kind of hit or covered. So what I'd like to do is see if we could get kind of folks from the group to be willing to go in and do a closer reading on some of the things that are out there for these spaces. Does that make sense? So a little bit of research homework along the patient focused, provider focused, administrative and business support, and then diagnostic AIs. Do we have any volunteers? Anybody want to take a dive into one of these particular topics? I can throw myself out there first. I'm sure we'll be going into a lot of these, but this is really where I'm probably lightest and I want to know the most. So I'm going to add my name onto some of the patient focused. I want to see if there's any kind of what's happening in the chat box. How are organizations having AI interact with patients? So I'm going to put my name on that one. Volunteers?
Are you looking for just the outermost black bullets or the white sub bullets?
Yeah, I would start with the top black bullets, but understanding that the white bullets that we've put in underneath those are of interest within that larger bullet. And if you find one particular area you want to focus in on specifically, we'd put your name at the top, but you could do a deeper dive in that area.
All right, yeah, that's helpful. I was asking because like the accessibility section overlaps with one of my other projects enough that I can definitely justify that. But it doesn't help you in terms of parsing out the further black ones. So I can also take another group.
No, that's
lower-
great. We'll add you to the top and add you below. So you have to do twice the amount of stuff. But yeah, if you want to kind of bring back stuff on accessibility.
I'm happy to look into some of the consenting.
Okay.
And I apologize, is this document shared with us, Jordan, or will it be?
I sent out a PDF version. I think this is living in my Confluence right now. To be honest, I kind of pulled it together from our notes from last time, a little bit too close to the appointment date, but I will upload this to a Google Doc. Well, okay, I say Google Doc. I know people have had trouble accessing Google Docs previously. Is there a better way to do it? Or I could put
Google
this in a
works for me.
Word, Google Docs?
Yeah, Google
You
Docs
like
is good
that?
for me.
All right.
And when is our
Right.
next meeting approximately, do you think?
I think we have one scheduled, don't we? We
Do
put them
we?
out every 2 weeks.
Okay, perfect.
Let's check. Yeah, so we've got one on the 20th.
Just so I know due date.
I mean, Jordan, you can put my name. I'll start doing some stuff around some of the diagnostic pieces. I mean, I'm interested in looking into several areas here in preparation for my presentations at the Matrix. But I'll start off here just sort of digging into some of that.
Yeah, and Brian, we want to help you partner with you on that. So just, yeah, obviously we can look at more than one thing, but I think, yeah, cool.
I'll look at some of the administrative uses for AI.
Calvin, can I volunteer you for provider support?
Sure.
Some of the, what was it? What's the Microsoft solution that we've been looking into, and some of the-
Nuance.
yeah, Nuance and a few of the other ones. So, okay.
Wasn't there a COE presentation in Rockville about like AI and virtual scribing? I
Yeah,
was just
that was,
thinking of another
was that,
use case that might help him.
was that
get down road.
UMMC?
I think so. Yeah, because it wasn't Ryan's team. It might not be useful. I was just thinking, that it was definitely one of the first times I had heard like a crystal clear use case. Large health system.
Yeah, I think you're right. UMMC had done a study on scribing, and I don't think that it felt like the results weren't like very stellar. Am I remembering correctly? Like I'm trying to remember. There was so much information that they passed on.
Why I brought it up, because I remember it being like a lot of providers in the the fat part of the curve being like, this is fine, or I've stopped using it, and not a ton of folks in the front half being like, I'm using it every day.
We also at the HIMSS conference there was a use case presentation on using AI to do notes to patients, patient generated notes, so it would generate a template for you. And then they gathered a lot of feedback from their users as to whether or not they liked it, and it was really mixed. I need to find that white paper and see if I can't add that to the list. Okay. I think this gives us some things to do. There's not a lot of if you find yourself kind of heading into a particular tangent or something, that's fine too. I just want to make sure that we're kind of focused on some sort of structure so that we can pull something together so that we can share. But there's a lot of things to go over. It's definitely bigger than a bread box. So, you know, I think kind of bite off what we can chew, and we'll chew on it and see what we can kind of pull together.
There you go.
Sound good?
Absolutely.
All right.
Well,
Anything
thank you,
else?
guys.
Yep. Okay, appreciate
Ed.
it. Calvin's been recording, so we'll post the recording too. So thanks, everybody.
Thank you.